Hey guys, welcome back to PW Medan YouTube channel. So I have with me Dr. Gajendra Singh Rathore, and he's got an amazing rank. So this is his day, and rank of 587 in a competition of 2.4 lakh people is not a small feat at all. So Gajendra, how are you feeling?
I'm feeling elated.
Great, great, amazing. So can you just walk us through you have completed your internship just now, right?
Yes, I have finished my internship in February of this year.
Superb. So you completed internship by February, and it's like almost because of the delay. I think it got delayed by 1.5 months of the NEET PG. Otherwise, you
Yes.
must have got this feed much earlier. So 4 months after completing internship, getting a rank of 587, when you got that PDF link, how was you feeling? Were you expecting this first of all?
No, I wasn't expecting this because I had saw some recall videos and everything. So I knew that I was getting about uh, 35 plus minus 5 incorrects. And
Okay,
that's the thing with recalls. You can't actually predict. And
true, true, true.
there were people who were like conjecturing that this year the rank will be higher, there will be clustering at a higher ranks.
Mhm.
I didn't know that this it will come out to be that good of a result.
So what was the first feeling? Like, did you double check your number? Is it really
Yes, I did. I triple checked my numbers. I still do. I'm still doing that.
so perfect?
Just
You
to
are
make
at your
sure.
home now?
Yes, I'm not at my home. I came back to Jaipur because I had plans before that. Irrespective of my NEET PG result, I would still give INI-CT November a shot.
That's
But
great.
I did not perform well in the May INI-CT, so I did
Okay, that's great.
want to do that.
So once you got the result, whom did you first call?
Whom did I first call? I called my parents.
So how? So you see, first of all, the most important thing is obviously the maximum credit goes to you, and I would say equal credit goes to your parents as well. So completing internship, SMS Jaipur, I think internship must have been hectic. It's not something. It's a very light internship. We've got students previously from Jaipur, SMS Jaipur as well. So how were you able to manage your internship as well as studies? That's the first question. The second is how important was your role of the family, your parents, your if you have siblings, what role did they play?
The During your internship, it's definitely not that easy to study and balance the things, but you can like start pretty early in your internship times and like give it a first read, take your time as much as you want. And once internship is over, and then you get this that stretch of 3 to 4 months where there is no disturbance, and try not to indulge in things that will take up your time. Try to only study and only study in those days because those 3 to 4 months really make a difference. During your internship, you might not be getting good ranks in your GTs or good scores in your GTs, but after that, after once you have just given a read through of your notes during your internship, that helps a lot. So try to at least cover your subjects once during your internship, and after that you can like really speed up your process and get better marks. And
Great.
to answer your second question, my parents did help me a lot, but more than them, I would say my friends, because my parents belong to a remote area. They don't really have a lot of knowledge about what's the paper like, what is the situation like, competition like. But my friends, especially if I could mention one name,
Please,
is
please.
Dr. Sanskriti. She helped me a lot. She did. She took out all the time. All of my friends too. I have a big group. I am blessed with great friends. I had 9 to 10 of our friends. We used to study together. We used to uh, like bounce off concepts and MCQs of each other. So that helped me a lot.
Perfect, great. So you said that friends played an important role after the parents' support as well. So most of the students say that a group of friends who have start early, they get to have a better rank. So when was your preparation? Like when were you serious about okay, I have to start reading about NEET PG? Was it because these days students like from first year I have to read for NEET PG? Is that the real rule or a start somewhere little bit after your second year or third year? Is that is also okay? So what is your goal? What did you do?
So I started watching. videos and notes of subjects from the second year itself, but that was also not like it was not that big of a deal. I just saw some videos, saw some lectures, completed some subjects of second year only, and that too only for the university exams purpose. I did not solve any Q banks. I did not give any GTs, nothing. And then when I came in the third year of my college year, that's when I really started to like because it was kind of a norm in our college that people start preparing for NEET PG from the third year. So I started preparing for the NEET PG from the third year, and I gave my first GT in during my internship, like the start of my internship. So that's how I did it.
Great. So, you said you gave the first GT in the start of your internship, and you also said that the preparation started on and on around the third year. I think final year must have been definitely hectic for most of you. Clearly,
Yes.
the university exam is more important than that time looking for NEET PG.
Yes.
One thing most of the students say is like, I have to complete 19 subjects to give a GT. What is your take on that, and what did you do?
I did. I gave my first GT without preparing any subjects, and to no surprise, I didn't get. I got marks to compared to that preparation. I got some 92 correct or 93 correct, to which also I was surprised. Yeah, I could get this many also correct. So I would suggest that don't wait for your GTs to start giving your GTs after 75%, 80%, because that's great. But overall, if you really want to learn something, if you really want to improve your skills, it's not about the theory bit. Everyone knows theory. You'll also know your theory once you have read it 2 to 3 times. But once you start solving questions and once you start giving GTs, that's when you really start to know what is actually important in a topic, because you have a lot of content. There is a lot of content on internet, in your notes and everything, but there are fixed questions from your topics that are being asked again and again, which you tend to forget. So that's very important. Like if I have to say, if giving GT is like just 10% of anything, reviewing your GT, that's the real. If you are not reviewing your GTs, then it's as good as not giving a GT, because that's nothing. You have done nothing. You don't know what you have marked. You don't know why was something right, why was something wrong. So I would suggest, even more than giving a GT, reviewing a GT is way more important. Don't give a GT if you're not ready to review your GT. Start reviewing your GTs as fast as you can. I learned that pretty late in my preparations, but once I started reviewing my GTs, my marks did improve. I could see an improvement.
So thank you for that advice to your juniors. Like, and like I said before as well, when you talk after achieving something, there'll be lots of your juniors looking up for you, right? So what do you tell them? Quantity of MCQ solved is important, or the quality of MCQs and analysis is important?
I would suggest the quality is way more important, and especially if you are feeling overburdened by so many Q banks and GTs and everything, then at least like the bare minimum that you can do is solve your PYQs. Solve your PYQs and make it a habit. It will be very daunting, but make it a habit that you solve your questions and read their explanations from the first line to the last line. Even if you know the topic, there's nothing, maybe you won't gain anything out of it, but still go from the first line, from the first word to the last word. It helps you in ways that you are not aware of, but it will help you when you're giving solving that Q bank again. You will have more confidence in that topic. You have more confidence in that area in which questions are asked. I would suggest that please for- do as many Q banks as you can, but still, if you can't, then whichever ones you are doing, review them, read them. Maybe there are some topics which have never been asked in your NEET PG or INICT or any paper, but still read them. It's a healthy habit. You will see your results improving after.
Great, super. Is there like one more question? Like, just what are these favorite subjects among the 19? Do you have any top three favorite subjects?
I would say my favorite subjects are first is anatomy. I like the anatomy. It's not something that many people tend to like, but it's something that we in our college years we got the lockdown in our first year, so I had a lot of time. So I read anatomy from the textbook and I
That's
supplemented it with atlas. So I was like really fascinated by those pictures, and so that helped me a lot eventually to answer questions which are out of your normal areas of
normal
focus
PYQ.
in your PYQs and PYTs. And that's one thing, and that's one subject. Then there's microbiology, because it was one of those subjects that was very weak. That was very weak for me. I had to like study it 2 to 3 times, but after a point, I realized that it is one of the easiest subjects to score. If you like read the theory 2 to 3 times, you'll never forget it. So that's the second subject. And the third subject that I did like was, I would say, medicine. I like medicine.
Perfect. So on a lighter note, is there any subject which you didn't like, or it's like why did they keep the subject in the entrance exam?
It's not that I didn't like it, but that's something that I didn't used to score great in, and that's pharmacology. I don't know why, but I used to get a lot of questions wrong from pharmacology because
Great.
maybe I had studied it from some revision sources, or maybe my knowledge was not adequate for the paper. That's why I used to lack in pharmacology, and I had a resistance towards it because my scores were not improving in that subject.
Fine. Fine. So, like, score of 587, you might be getting most of the branches in the colleges available for us. Like, what is your go-to branch? Like, what do you want to do? Is there any aim? Like, I want to do this specialty, I want to do this, I want to be like this in the future.
I it's a personal thing that during my last few days, last few months after my internship, a close friend of mine, I told you her name is Sanskriti. Her father was diagnosed with blood cancer, diffuse large B cell lymphoma. And then there were my grandmothers too in the past, and my grandfather too. He was diagnosed with gallbladder cancer. My
Sorry.
grandmother was diagnosed with breast cancer, and they all passed away due to the severity of the disease. So that's something that like stuck with me, that maybe I should go in these branches, because what I have seen in cancer branches is that the the weight of your words, the weight of the doctor's words is very heavy. Because if a doctor tells you that you are gonna be fine, then it like literally makes you feel a load that has been taken over from your head. So that's something that made me realize that this is the branch that I should go towards, because it would help a lot of people, and there has been an increasing trend too of cancers, I believe. So I want to go in cancer related fields, and medicine oncology is something that I am looking forward to. So maybe I'll stick with medicine. Surely not any surgical branches, for I'm not. I can't stand that long. I can't stand for those long hours with those in
Got it.
those OTs. So that's the thing.
Thank you for sharing that. Sorry for your losses. And I hope that in future, many more families will be benefited by you. And I think universe will definitely conspire towards your aim and goal if it's driven by a good cause, right? So was this kind of a driving force for you to push yourselves when you were down? Like, okay, these are some things which I have seen in real life. So maybe like maybe this is my purpose in the life to make it happen.
Yes, it did. It did. I wanted to be on the other side of the table, counseling patients and telling them that it is treatable. There is like helping them out. So if I know many cancers are like they are a financial burden, they are a social burden, emotional burden. Many patients like can't live with that. Even if it's treatable, they can't live with that. So I talked to those patients. I talked to my friend's father. I counseled him. I told him to have faith in the treatment, to like go through with the chemotherapy cycles. So that's so, and he really appreciated me talking to him. And a lot of people told me that you have a knack for talking to people and how like consoling them and that thing. So I believe that I should be in a branch that is more that has more of patient interactions.
Hopefully that will come true, and hopefully, like I said, many patients will be benefited. And I think the father is your best friends you initially mentioned, right?
The
The best friend's father had BCL, right?
DL.
And I think it's really very nice of her to help you inspire
She
your
helped me
own for you, in
because
spite of having some bad things which is going on in the
uh,
family.
yes, her whole family was like supporting me because they I had to there was a paper of medical officer in our state just after our internship,
Mhm.
and during that time, those 15 to 20 days, I did not study much. I used to go help them out in the hospitals and all the reports going from one clinical hematologist to the next. So that's something that they really appreciated. And when my I gave my medical officer exam, so all of my friends got selected, and I didn't because my I had cleared the cutoff, but my age was not that high. So there is a trend that they take
Senior.
older individuals first. So they took someone else, and I did not pass the exam. So they were very like they were feeling very sad that somehow it's on them that I did not get selected because I couldn't study. So
I think you
that's
should tell
something.
them it's a bigger picture, which is there's something waiting for you rather than the medical thing board exam. I think you will become a medical oncologist and maybe go back to the same community and serve in the future. So, any few words, like last few words, which you have to tell to your junior, because I personally feel with interacting with quite a few juniors, they are, it's not exactly the word to use, lost, but it's too much for them. It's too many things coming at them. Like you have your university exams, the colleges become much more stricter. The final year, which is who's currently sitting, is going to have face ENT off there also in the final year, maybe with a couple of more batches, and then the uncertainty always stays. It's NEET or next exam. So, what you want to say, like if you are a third year student, if you can go and meet your third year student, you will say these are things which I did wrong, which maybe would have made my life a bit more easier towards an exam. Is there any few words we want to tell your juniors?
If I could go back and tell myself one thing was that I personally used to take watching your videos and seeing you completing your notes as a big achievement or a big that I have done this subject. But that's not true. You should realize that watching videos is just passive learning. Even if you read your notes, you revise your notes, that's nothing. You have to solve questions. If you don't solve questions, it is the question, the MCQ based exam. It's not a subjective exam. So you have to solve your question banks. Even if you have seen your video, don't feel satisfied that you have watched your video. Feel satisfied when you have completed the Q banks of that subject. That now my subject is done. It will play a big role. If you are not completing your Q banks, then it will come to haunt you when you like start preparing because you don't know what's important. You have still now you have still only studied for your university. I'm not telling you to not take your universities seriously and completely focus on your NEET PG. No, but still solve question banks whenever it's possible, however it's possible, and read the explanations, please. It will help you a lot. Even if you are not if you even if you don't see the results like uh, at the very like you don't see your results instantly, but it will show up one day. And the second thing that I can say is don't be stuck on the rote learning. Like I have to know everything word by word. No, don't do that. Just read your notes and solve questions. Don't be like fixated on that. I have to know everything word by word. Even if you read it, it is more than enough. Your brain does learn when you think you're not learning. It still does learn. Just read it and then solve question banks, it's more than enough. Your first reading is more than enough. If you do this, read 50, 60 pages a day, solve their question banks, related question banks, and move ahead. That's something because I was very fixated that I have to know everything, and that delayed my progress a lot.
Understood. Thanks for your sweet words and your sweet wine. And I think this is not an EPG's victory. I think my country's victory to have a future such a calm and a composed oncologist. And I hope many more patients get benefited out of your knowledge and experience.